Good afternoon, Archcare. Jessica speaking. Can I help? Oh, what's your date of birth?
My name's Hannah. I'm an advanced nurse practitioner at Arch Healthcare.
Great, thank you. I'll pop that down just so the doctor's got a bit.
Arch is a community interest company, healthcare company, and we exist to provide healthcare to people who are homeless or vulnerably housed in Brighton and Hove. Homelessness in Brighton and Hove is a big issue, and the clinical commissioning group have commissioned us to provide specialist primary care services to that population. So that's primary care in the sense of a GP practice, but also inreach into the local hospital, outreach into the community and day centres where patients tend to congregate, and into hostels as well where patients are. So when lockdown did start, it did present big problems for our patients because their sources of food had suddenly shut down. You know, the day centres that they would go to for lunch or dinner, you know, had closed. There was now nowhere to go to the toilet because all the public toilets had closed, and again, all their day centres had closed. So we had a situation where very quickly our patients became really quite vulnerable, because not only were they living on the streets, they were now living on the streets with no access to food and no access to sanitation. Their risk had increased, you know, rapidly over a number of days.
My name's Emma Jones. I moved down to Brighton from London because I'm fleeing domestic violence. I'm claiming I'm homeless because if I go back to that house, my life's in danger and my children's lives are in danger.
At the start of lockdown, it was really hard to find places that people could go into. And there was this very difficult period where for a while we'd closed the congregate accommodation, but still didn't have anywhere to move people into. And the teams at the council were doing lots of negotiating, lots of work reaching out to different companies and organisations trying to find the rooms. We were quite clear that they had to be en suite, so people had to have their own toilet. And we're also clear that they needed to be able to be supervised and supported whilst they were there. So what made sense was to have somewhere like this, a hotel, where staff could be downstairs to provide support, but where people could have their own ensuite facilities as well. And what worked out very well was that we were able to secure a few hotels due to the hard work of the council, and that meant that we could place people in the hotels according to their different levels of need or different risks of catching COVID. So we could have slightly different criteria, slightly different ways of operating in each of those hotels.
My name's Jordan Johnson. I've been in this hotel now for about 7-8 weeks. I was sleeping on the streets before. Nearly 3 years I've been on the streets.
We've had to change how we operate a lot, both at the surgery and providing outreach. So at the surgery we've moved to largely telephone calls, and we've had to increase the amount of outreach that we provide quite considerably.
That was very helpful to me. I didn't have to go in there. All I had to do was speak to them on the phone, and they sorted my prescription out. They faxed it to the chemist. It was very helpful. It was. Yeah.
We're on duty from 9 to 5 every day to discuss any coronavirus issues or to do any triaging that needs doing. But we also visit the hotels in person every day. So either a doctor or a nurse, or sometimes both, go to the hotels to see what health problems have been arising and advise the staff, or see patients if needed, to see what the actual sort of medical problems are aside from COVID, because obviously putting everybody into hotels means that you've brought lots of people in with conditions that maybe haven't been treated properly or been neglected for a long time.
Arch have been great. They really have been great. I'm epileptic, so I find it really hard with my meds. The meds I'm on are not working properly, so at the moment they're trying to find out what's going on and all that. I suffer from really bad depression, which sets my asthma and my epilepsy off. I was a heroin addict, and they've helped me get on a script of Subutex. And I feel like I'm a normal self again.
We've registered loads of patients that we previously didn't know. Some of them have been, entrenched rough sleepers, so people who've been on the streets for years but have never engaged with services, who at this point are engaging, and because they're in the hotel, someone supported them to fill in a GP registration form, and then we've started working with them.
I don't think I went in a day centre for like 9 months. I had a cup of tea or like nothing. I just was taking loads of drugs, having medication, drugs. It was like, wow, I was going to end up dead. And I've come here and I go and get my methadone every morning, and that really don't bother me. I've got a lot of healthy since I've been here.
If you're having to spend all your time making sure you've got a warm drink and some food in the winter, you're not very likely to address your health problems. So with all those basic needs being met, it means that people have been able to address those.
One of the really great things that has happened throughout all of this is how different agencies have come together. And I think Brighton's always been pretty good at working together and across different agencies, but I think throughout this pandemic, it's really brought people together. And so St Mungo's they are the Rough Sleepers charity, a nationwide charity, but they provide the rough sleeping services for Brighton. And they've taken a really lead role in managing the hotels, staffing them and supporting patients and clients whilst they've been in the hotels.
I feel safer, yeah. That's what it is, yeah. It's having someone awake around you that's got your best interests at heart. And it's also having somewhere with a bit of structure, like a wall and, a door. It's somewhere safe.
So what we find is you bring people who often haven't had somewhere nice to sleep for decades, and may have never had their own shower or their own toilet, and may never have had 3 meals a day. And you put them somewhere and you say, we're going to look after you, support you. If you start feeling poorly, we'll get someone to see you and move you to somewhere where you can receive care. But in the meantime, you're here, you're safe. You don't need to worry about how much money you have. You don't need to worry about where you're sleeping. You don't need to worry about what food you're going to get that day. And the extraordinary thing is if you give people that respect and that safety and that space, they are able then to reflect on what's brought them here and able to reflect on how they want to change, because this is something they want for their lives.
I'd love a job. I want a job and wages and routine and some structure in my life, man. I want to do something educational, like a course, and like I said, try and get a job and things. I want to build my life.
While there was the initial crisis, we were just all hands to the deck. Let's pause everything that isn't super urgent and just do everything we can to keep people safe from COVID. And that's been much of what's been happening in the hotels. But now we're moving to a different stage, which is the stage of there still being COVID in society, but actually we need to start looking after people's long-term health as well.
We're getting to a point now where we need to see people face to face again, and have that interaction and that dynamic to the consultation of seeing somebody, whether that's for mental health or physical health. Patients might need examining, but equally for mental health, sitting in front of somebody and having that conversation is a wildly different thing to trying to do that over the phone. So we've worked quite hard in the surgery to help our staff to be socially distant from each other. So that's meant a bit of shifting about of where people are working and where people are based. In terms of our clinics, there's extra slots for cleaning in between seeing patients, which is all stuff that we were doing before, but it's just allowing a bit more time and space for that and making sure that everything is cleaned in between each patient coming in. We've started wearing scrubs, so we're a bit more able to change our environment from in work to out of work.
We're facing the fact that one of the hotels is reopening to the public, so we're having to move 80 people out of that hotel. And in a couple of months' time, the other hotels will be closing as well. We need to have a think about, and we've been very involved in these discussions citywide, about how we continue offering support to people when they're no longer in the hotels and when they might be more dispersed throughout the city. And it's a real worry of ours that if we don't get that right, if we can't offer people good enough accommodation and good enough support, that there might be a drift again back onto the streets.
Because people have made these great health gains, because the services have all worked so well together, we want to make sure that that continues after the pandemic has gone, because it's so obvious that it's much, much better for people to have somewhere to live. Their health is going to be better if they have somewhere to live than if they're living, in a doorway out on the street. So we're hoping that we can maintain some of that gain that we've managed to foster during the pandemic.
It's my hope that we don't kind of just sort of draw a line under lockdown and go back to high levels of rough sleeping and vulnerable housing. It seems like we've made lots of really positive impacts on this community, and it's an opportunity to keep building on that, not to undo it. And so I would really hope that as a city we can find some solutions that are more long-lasting for people.